Hey, aloha gang, Dr. Russ Rosen here. Welcome to the OHC Facebook community. And I'm going to go ahead and check and see if it's actually live, because sometimes it is and sometimes it isn't. Okay, so far it isn't showing. Let's go ahead and check. There we are. Good, it's showing. All right, cool. So we are here. I'm Dr. Russ Rosen. I am here Tuesdays at 1:30 California time, 3 Tuesdays a month. Today we're diving into difficult questions, difficult patients, difficult situations, and how to handle them. We all want to have great experiences with our patients. We want to have a good time at work. We don't want to feel the kind of stress that can happen when we're in uncomfortable situations. But the reality is sometimes we find ourselves dealing with a difficult patient, a difficult person, a difficult situation, a difficult comment, a difficult question, a difficult interaction with our staff and a patient, etc. And if we don't handle these things appropriately, we can ruin the relationship. We can find ourselves in all kinds of trouble that we really didn't need to have had we just known how to handle it. So today is all about how to handle difficult patients, questions, situations, etc. So think about this. Have you, oh yes, I meant to ask, my bad. If you are live with me right now, please go ahead and post. It'll say who you are, put where you're from. Also, if you're watching this on a replay, if you have any questions, go ahead and post any questions. If you have any questions live right now, and you have any questions, just go ahead and post them. I will, at the end of this wrap that I'm doing, I'm going to go ahead and answer any questions for you. Okay, so let me see, something just popped up in the middle of what I'm trying to look at for you. There I am. Okay, cool. So, all right. So, have you ever had a situation where you had a patient where they asked a question or they made a comment and you just did not know how to handle it? Or have you ever ruined a relationship that you kind of regret? Or have you ever heard your staff talk with a patient and cringe as they were having this conversation? Most of us have. So this is all about how do we handle it. Okay, so foundationally, this is built on LASER. It's an acronym: listen, acknowledge, ask, solution, resolution. For so many of us, we just go right to solution. We just tell them what the answer is. We tell them what we have to tell them. But that is oftentimes the wrong thing to do. It's not what works. So we need to enter the conversation in their mind. So the first thing we have to do is listen. And I would ask you, why is it that we need to listen? And the answer, of course, is so number one, that we know what they're talking about. We know what they mean. And the second thing is, and this is important, so they feel heard. It's not just important that we get to say what we want to say, but it's critical that they feel heard. So we want to listen, and then we want to acknowledge. So when we acknowledge, again, it helps them feel heard. It also can de-escalate the situation, right? If it's starting to ramp up and you just go into, well, then you're going to have to do this kind of thing, that's what's going to lead to problems versus acknowledging, boy, I sure understand how you feel about that. I would feel that way too. I'm so sorry you're going through that. That must be terrible. That must be awful. That must be concerning. Like whatever it is, just acknowledge that. Be a human being first and a doctor second. Now, the third thing we're going to do is we're going to ask. We're going to ask clarifying questions to help them find the truth. Now, if you've been following these, we've gone through the neuroscience of communications, where we're using stories and metaphors and Socratic questions. We we're doing the entire process. How do you do in a consult, exam, reported findings, etc. So we know that we're going to acknowledge, we know that we're going to be asking these clarifying questions to help find out the truth. And really, those are the Socratic questions that we've been talking about. We then want to make sure that there is a solution. So a solution to the problem is different than resolution. Resolution is that we're both really happy about the solution. We feel that there's a resolution. So people may say, I want to go down from 3 times a week to 1 time a week. And you might say, no, sorry, you may want to go stay at 3 times a week, but they want to go down to 1 time a week. And you might tell them, no, you need to stay at 3 times a week. So the question is that a solution? And the answer is, yeah, that's a solution. Is it a resolution? Might that resolve this problem? No. So there's a real difference between those. I don't know if you can hear my dog barking, but my wife isn't here right now, so I'm going to have to grab my dog. Give me 1 second. You, come here. Right now, come here. Come on. Oh, I know. Oh, I know it. I know all about it. The pool guy is here. That's the problem. The pool guy is here, and she's got to let him know all about it. So I apologize about that. Okay, you're okay. That's all right. I know it. I know all about it. I know it. Okay. We're having a difficult conversation. You can see I'm having to acknowledge. Right? Now I'm going to start asking her clarifying questions. Only kidding. Okay. So there's a difference between a solution and resolution. Now, before we can start doing that, there's a particular template that I want to walk you through. And it goes like this. The first thing I need to do is a temperature reading. I need to check in with you and see, are you upset? Are you angry? Are you triggered in any way? If so, don't have this conversation. You're going to regret it. So, you know, my doctor says that I should stop seeing you. My real doctor says I should stop seeing you. Does that trigger you? Does that piss you off? If it does, you want to have trained on how to answer this question so that it doesn't charge you, okay? In the club on Thursday, we will be training on these of exactly how to do this. I'll be giving you a 32, it's a document with 32 of my favorite challenges and questions that people have, and showing you exactly how to handle those in these steps, as well as from a laser perspective. So the first thing is for you to do a temperature reading. The second thing is to look at, she's sitting on my shirt, is to look at the classic blunders. So what could a classic blunder be? This is how we train on this stuff. In essence, there are assertives and non-assertives. So an assertive gets angry. They render themselves offensive. If you find yourself saying, I'm just telling it like it is, you're probably an assertive, and you probably offend people all the time. Okay. If you're non-assertive, you join what I call the okay corral, where you just go, oh, okay, I'm gonna go down from 3 times a week to 1. Oh, okay. Well, I don't think I can pay that much. Oh, okay. You just find yourself in that okay corral. Neither of these serves you. Neither of them serves the patient. So we really have to look at other ways of dealing with this. But you want to know where you oftentimes will go, right? You want to look at your default, and then don't allow that to happen. You just want to be in the center, having a real conversation. Listen, acknowledge, ask clarifying questions, help find a solution, make sure that there's resolution. Now, the next thing as we're training on these is for you to look at the implied message. Obviously, I'm boring Roxy here because she was just yawning. Could you just adjust my low back today? Well, what could the implied message be? The implied message could be, could you just adjust my low back because you hurt my neck last time, so don't touch my neck. It could be, my low back is really sore, could you just adjust my low back today? You don't know. You don't have a crystal ball. So until you know, you can't really respond appropriately. One of my favorite questions is, why do you ask? Just clarify. That's a clarifying question, right? I just need to clarify, why are you asking this question? And from there, I can go ahead and deal with it. Okay, again, this is how we train on this stuff. You're not doing this in the moment. You train on these. Okay, and then the thing I want to go through is, what is your truth? What would you want to say if somebody said, could you just adjust my low back today? What would you want to say to them? Sure, I'm happy to just adjust your low back today. I need to do an evaluation to see what you actually need. Is it because we had hurt you? And if so, right, you've got to get clarity on why they're saying this, which of course is going to change your response to it. Now, classically, if you were a non-assertive, you would say, oh, okay. And then you go home and you would stew about it, because you know that that's not right to just adjust someone's low back. You got to do what shows up in your system. If you're an assertive, the answer most likely is, no, I'm the doctor. I'll tell you what you need. Again, these are things that you want to train on. So here are classic issues and blunders. You know what? I got to tell you, that's too expensive. Well, what might an assertive say? Are you kidding me? You can't afford not to get care. If you don't get care, you and your next 5 generations are going to die slow, miserable deaths. Rah, 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 rah. Right? What's a blunder for a non-assertive? That's too expensive. Oh, okay, I'm sorry. Well, I could do it for cheaper. I mean, I could come to your house and do your windows and in your toilets. Right? So like, which one are you? Probably somewhere in between. Okay. I don't have time. Classic blunder. Same thing. You can't afford not to come in here. You have to do this. Oh, okay. Well, how much could you come in? Okay, well then we'll just do that. Versus asking clarifying questions, finding a solution, making sure there's resolution. Again, on all of these, we'll be diving deep into, and I'll be giving you a document. If you would like to jump into the club, I'll give you a free month. Just go ahead and put me below, and I'll send you a link. On this scale right here, I think -10 is near death, 0 is comfort, +10 is optimal health. So somebody's really sick, they're really miserable, they're overweight, they're in pain all the time. Clearly they're somewhere down here. And you ask them, where do you think they're at? And they go, I think I'm a +6. Right? What would be a classic blunder? Are you kidding me, you fat shit? Are you kidding me? That would be an assertive. A non-assertive would go, oh, well, okay, if that's what you think. Again, I'm kind of making fun of this, but these are the kind of things that we do versus just being honest and straight with people. But we don't want to just jump to solution. We want to listen, acknowledge, ask clarifying questions. And I'll be showing you exactly how to ask clarifying questions to help them recognize, for them to say, oh, okay, I get it. On this chart, I'm actually probably around here. Right? So there's all kinds of different questions that lead to these kinds of blunders, and we'll be talking about those. Other ones, I can't come in anymore because my insurance doesn't cover you. My real doctor said I shouldn't see you anymore. Can you not adjust my neck today? You know what? That last visit really helped. I know that sounds goofy, but there's a real classic blunder that docs will do with that. Why are you working on my low back today? It's my neck that hurts. Do you think that there could be something else wrong with me? You know, my real doctor said blah, blah, blah. So here's the scoop on this. These are really important. They're more important than you might think, but once you start to think about it and listen to what happens in your office, you'll recognize there's probably truth to that. Again, these are things you can start to play with. If you would like to train on this and then learn how to use listen, acknowledge, ask, solution, resolution, and get the document with 32 of my favorite challenges. It's not 32 pages. It's 32 of my favorite, most favorite challenging questions and issues, etc. Just go ahead and put me below, and I'll get you into the club. So I'm going to go ahead and check and see if there's anybody there live that has questions for me. Nobody has questions for me. So hope you found value. If you know other folks that you think could find benefit from being in this community, please go ahead and let them know. If I can help in any way, just comment below. As always, much love and aloha. Say aloha, Roxy. Say bye-bye. Say bye-bye. Bye-bye. Bye, gang.